Good morning. Welcome to A Year of Mindfulness. This is week 5, and the topic this week is eating your vegetables. So years ago, I came across a study that talked about how patients that ate at least 5 fruits or vegetables a day had significantly less heart disease, colon cancer, prostate cancer, Alzheimer's, dementia, less anxiety, less depression. They slept better, and a host of other health benefits. And so I've been recommending that to my patients for years. And I was going online to try to find the source of that study, and I came across a new study, and it showed that eating 10 vegetables a day nearly doubled the benefit of decreasing your risk of heart disease, stroke, and cancer. And I thought that was really amazing because food is so important. I see so many patients that struggle with their weight and their diet, and even yesterday I was talking to a patient, and I'm like, oh yeah, he's like, I love fruits and vegetables, I eat them all the time. I said, well, how many do you get a day? He's like, well, 1. And I said, no. He said, there's a reason your cholesterol's high. You need to up your vegetables. You need to be eating at least 5 a day. And I've been encouraging my patients to do that, and it's amazing how powerfully food can heal your body and prevent diseases. And so if there's one thing I could encourage everyone to do is eat as many vegetables as you can eat. One thing that I wanted to mention that how to help people gauge how they eat their vegetables is to imagine a dinner plate, and they say the plate method is it's a federal recommended objective to do half a plate of vegetables, or a quarter of your plate be a carb and a quarter of your plate be a protein. So whether it's plant-based of beans, or whether it's meat, to focus on eating a half plate of vegetables at lunch and dinner. And I think that if most people would work on that, just one thing, they would notice improvement in their weight, they would notice improvement of their diabetes, of their blood pressure, and so many other health problems. And so so many times I see patients, I give them a diagnosis of diabetes, and they're like, well, I knew it was coming because, I got family history of diabetes, and, there's just nothing I can do about it. And so then I try to educate them, that maybe it's not necessarily their genes, that maybe a lot of it may be due to their family's lifestyle, and how 60 to 70% of your health is based on your lifestyle, whether you smoke, whether you drink too much, whether you exercise, whether you eat a healthy diet. So much of that plays into your lifestyle and your health, and only 30 to 40% is due to your genes. And so I try to encourage my patients to make healthy changes to do better and to improve their health. So this week I want you to focus on getting as many vegetables and fruits into your diet as you can. Okay, preferably more vegetables, particularly non-starchy vegetables like corn and potatoes, and starchy veggies like that are not going to give you as powerful of a boost in your health as things like non-starchy vegetables like kale, spinach, lettuce, cauliflower, broccoli, those type of vegetables. And particularly colorful fruits or vegetables are also really important. Things like grapefruit, peppers can be very helpful. So when you sit down, my preference when I eat the plate method is to always eat my vegetable first, because I know it's going to fill me up. Sometimes I often try to drink a glass of water, to that way I'm that much more full, so I get fuller faster. So even if you're eating a piece of fried chicken that is really fatty with the mashed potatoes and really greasy gravy, you're not going to eat as much because you're already half full of broccoli. So good luck with this week's tip, and we'll see you next week. Take care.